Hello, viewers. This is Dr. BK for you. So, in this lecture, I am going to discuss about the muscular system. So, you all know that there are around 650 muscles in our body. So, what is actually a muscular system? You all know they are actually the motors of the body, which produces contractions. So, any movement when we want to perform in our body, locomotion, we want to walk, sit, sleep, eat, all those things, this muscle is necessary. So, the action of these muscles, which means muscle act by contraction, which is very much essential for our day-to-day activities. Not only that, muscles also is the place where the energy is stored. They store glycogen. They also spend a lot of energy. They give shape to our body. They are helpful in moving the joints. Fine. Now, why the term muscle? Because initially people, when they described about the muscle, they found out they resembled a mouse. The main body or the belly of the muscle resembled the body of a mouse, and the muscle attaches itself to a long cord-like structure which is called as the tendon, and the tendon resembles the tail of a mouse. Okay, so musculus is actually the scientific name for the mouse, and from that only the term muscle has been derived. So basically there are three types of muscles in our body. You are able to see that they are the skeletal muscle, cardiac muscle, and smooth muscle. So whatever be the type of muscle you see here, a muscle is basically a contractile tissue. So it can contract. The muscle is a contractile tissue, whereas a nerve is an excitable tissue. So through its contraction, it brings about various movements, and as I already told you that it maintains position, provides strength and power, gives shape to the body. So basically the shape to the body, and if our muscles are sound and developed, then naturally when we have a muscular build, we have a better shape. So lot of heat is generated because lot of energy is expended during the muscle action, especially when you actually exercise. Naturally what happens, you can experience a lot of heat is being generated. Then apart from all this, it aids in venous return to the heart. Now heart itself, you know, it is a muscular organ. The contraction of this muscle is responsible to pump the blood. That is for cardiac muscle. But other than that, the other muscles which you see in the body called somatic muscles, they aid in the venous return, because when the veins pass between these muscles, the contraction of muscles helps actually to pump the blood in the veins. Okay. So with this introduction, we will see basically we have striated muscle, smooth muscle. Under the striated muscle, you have skeletal muscle and cardiac muscle, because both shows striations or stripe, whatever you can call it. So the basic characters or features of these three muscles we will actually compare and try to understand how they differ from each other. The first type of muscle is the striated or skeletal muscle. Because why it is called a skeletal muscle? Because it is closely associated to the skeletal system. It is responsible for moving the joints and it is anchored to the bones. Mainly they are striated or striped. You are able to see here. and the muscle fibers run in a longitudinal direction, and at right angles to this you see these striations which are transverse in nature. Then you see multinucleated, so it appears as a multinucleated cell, but actually it is not multinucleated. Any cell can only have only one nucleus. I will come to that point later. Why do you call it as multinucleated? Then the action of this muscle is under our will. So if we want, we can contract the muscle, otherwise we can relax the muscle. That is why it is a voluntary muscle, and all the skeletal muscles in our body are actually the striated muscle. The next type of muscle is actually the cardiac muscle, a very special type of muscle, unique and only present in the heart. In this muscle also you see some striations, but not very much marked as in the case of the skeletal muscle. Then you can see these muscle fibers, they are branching, and the cells have only single nucleus, and that too only in the center. So uninucleated or single nucleus, and involuntary type of muscle. So it is involuntary but with striations, uniquely present only in the heart, and this does not undergo fatigue at all. So this muscle does not relaxes, it is constantly in action. Now the cardiac muscle also, you can tell that it is something transitory or in between the skeletal and the smooth muscle, because some properties of skeletal muscle, it shows striation. Some properties of smooth muscle is it is involuntary in nature. The next type of muscle is the smooth muscle fiber. Why it is smooth? Because there are no cross striations seen in it, so that is why it is called a smooth muscle. Nucleus is single in the muscle cell and it is in the center, and shape is actually fusiform. You can also call it a spindle shape, and where actually it is present in our viscera. So all the viscera have smooth muscle, that is in all the systems of the body, your intestine, starting right from the esophagus to the stomach up till the rectum, you have these type of muscles. In the ureter, urinary bladder, you have smooth muscles. In the trachea and bronchus, you have smooth muscles. Most of the ducts, you have smooth muscles. So it is actually mainly muscles of the viscera or organs, and it is involuntary in nature. It is not under our control or will. Okay. So that is a photomicrograph or a histological appearance of the skeletal muscle. There you can see the cross striations and multinucleated. Cardiac muscle, you can see the branching pattern, and something you see here at certain junctions, they are actually called as the intercalated discs. Okay. So again, I will discuss about what is this intercalated discs after a few slides when we come in detail in discussing about the cardiac muscle. And then smooth muscle, mainly as I told you, it is seen in the GIT, not only in GIT, in your genital system, urinary system, respiratory system, reproductive system, it is seen. Mainly spindle or fusiform shaped muscle fibers, no cross striations, completely smooth, and what happens is the nucleus is single and it is present at the center. This is a higher magnification of these three types of muscles. At higher magnification, when you see, you will be able to see the cross striations very clearly. Even here you are able to see the cross striations in the cardiac muscle, and branching of muscle fibers you can see very well. So smooth muscle fibers you are able to see with the nucleus. Mostly they appear flattened nucleus because the cell itself is fusiform shape, and they might be transversely oriented or vertically oriented, the smooth muscles. Okay. Now, we are going to see in detail about the characteristic features of skeletal muscle. Okay. So, skeletal muscle, as I told you, it is the somatic muscles which is present in the limbs, and also it forms the muscles of the body wall as well as the muscles of the neck and head. The muscle fiber might range from a few millimeters in length to 30 or sometimes 45 centimeters. Also, you are able to see this muscle, the sartorius, which is the longest muscle in our body. Then, it is multinucleated, as I already told you, and I told you it is not actually multinucleated, but it appears as a syncytium. So what is actually a syncytium is? In the last slide, we have seen the microscopic structure of the striated muscle, and we have seen many nucleus. It is actually not many nucleus, there are many cells with each nucleus, but the cell boundaries are inconspicuous. So it appears like a smooth syncytium, as if the cell boundaries are merged. So thereby it appears as if a single cell having many nucleus. It is actually many cells only. But due to this syncytial nature, that means the cell boundaries, they are not well marked when you see, and that is why it appears as if it is multinucleated. Okay. The skeletal muscle fiber nuclei are elongated and they lie to the periphery. So they are not in the center of the cell, they are actually pushed to one corner, and the cell membrane of the skeletal muscle is actually called as sarcolemma. It is actually called as sarcolemma, especially for the skeletal muscle. We don't use this term sarcolemma for the cell membrane of the smooth muscle or the cardiac muscle. There we call only it as plasma lemma. So when the cell membrane is actually called as sarcolemma, naturally the cytoplasm will be called as sarcoplasm. Is that fine? Okay. So next we will pass on to the organization of the skeletal muscle. So here we are able to see a large muscle, and in this large muscle mainly the contractile elements. Finally, if you take a group of muscle fibers, and from that if you carefully examine a single muscle fiber, a single muscle fiber consists of the contractile elements which appearing as alternative thick and thin bands, So they are mainly formed by these two elements, which is actually called as the actin and myosin filaments. So the actin and myosin filaments are nothing but the proteins which bring about the contraction. So these proteins, as I told you, they are grouped to form the myofibrils. So many actin and myosin filaments you are able to see form the myofibrils. So group of myofibrils you are able to see here. This is one single myofibril, but group of myofibrils what will form? This whole thing is a single muscle fiber or a cell, where you will see the peripheral nucleus, then you will see the sarcoplasm, sarcolemma, all these things. Okay. So from the finest detail, if you go to the gross level, you have actin and myosin contractile proteins. Bundles of this form the myofibrils. Bundles of myofibrils form a single muscle fiber, which we call it as a cell of the skeletal muscle. And groups of muscle fibers, they form fasciculus or bundles, we call it as fasciculus. And many fasciculus join to form a muscle. Okay. So if you look at the belly of the muscle, you will have groups of muscle fibers. If you take one muscle fiber, it will have groups of myofibrils. Okay. So that is actin myosin filaments. Many of such form these actually the myofibrils. Myofibrils go to form an individual muscle fiber, and many muscle fibers join to form the muscle. Okay. Now, definitely there should be some supporting tissue or which is present in between the muscle fibers. Endomysium is a connective tissue which actually surrounds a single muscle fiber. A single muscle fiber will be surrounded by endomysium. So in between the fibers, that's why you see this connective tissue component, which is actually called as the endomysium. Groups of muscle fibers, fasciculus of muscle fibers will be actually surrounded by a connective tissue which is actually called as the perimysium. Then all these bundles together are again surrounded by another connective tissue which is actually called as the epimysium. So you have endomysium around single muscle fiber, fasciculus of muscle fibers are covered by perimysium, and all the bundles of muscle fibers are again covered by a single connective tissue layer which is actually called as the epimysium. Then this epimysium is again further covered by the fascia. So the deep fascia as such, because the deep fascia, the one which covers the muscles and also it compartmentalizes the muscles. Like flexor compartment will be covered by a single group sheet of deep fascia. Then the extensor group will be covered by deep fascia. So only the deep fascia which separates the different muscles. Okay. So single muscle, what happens is after covered by the epimysium will be covered by the connective tissue which is the deep fascia again. It is also a connective tissue. Okay. Now coming to the structure of myofibril, we all know that cross striations are actually present, which is the most striking feature of the skeletal muscle. Now if you use some staining procedures and see it under the microscope, I told you, we have already noticed that in the first few slides of this presentation. It consists of alternate dark and light bands. Alternate dark and light bands which you are able to see here. The dark bands are actually called as A bands or anisotrophic bands. The light bands are actually called as I bands, which means they are isotropic bands. A band, I band, A band, I band. You have alternative thick and thin bands. A band is A for anisotrophic and I band is called as I because of isotropic bands. Okay. So here you are able to see a thick band which is actually called as the A band, and then a thin zone which is actually called as the I band. Now, the center of the A band, the thick band, in the center of the A band, again, you are able to see something called as the H band, or which is given here as the H zone, the line, which is actually called as the H zone. In the center of the H band, again, if you look, it has again a very pale region which is actually called as the M band. So, in the middle of the A band, you have the H zone or H line, and in the center of the H line, you see another area, thin dark line, which is actually called as the M line. In the center of the light band, this area, in the center of the light band, you are able to see a dark line which is actually called as the Z line. So this is actually called as the Z line. So here you are able to see the Z line. In the center of I band, you see the Z line. In the center of A band, this is actually called as the H zone. In the H zone, in the middle, you see a dark line which is actually called as the M line. Okay. So this is the Z line, or it's also called as the cross membrane, and this is the H zone with M line in the center. So between two Z lines, what you call this area is the sarcomere. So a sarcomere is the area of the myofibril between the two Z-line or Z discs. This is the basic contractile unit of the muscle. Okay. So a sarcomere is between the two Z-line and it is the basic contractile unit or the smallest contractile unit. When the sarcomeres contract, you all very well know what happens is the Z-lines will approximate. So naturally what happens, these areas will slide over each other. As the sarcomere contracts, the myofibril will contract. As the myofibril contracts, the muscle cell contracts, and as the muscle cell contracts, the whole muscle contracts. So you all know, once you would have done your biceps, when you contract, the muscle becomes stiff. So that means what is happening is the myofibrils, they are actually contracting. How the myofibrils contract? It is by the approximation of the Z disc. When this Z discs approximate, the sarcomere is getting contracted, which in turn contracts the myofibrils. When all the myofibrils they are contract, the muscle cell contracts and the whole muscle contracts. So this is the basic physiology behind the muscle contraction. So a simple animation that which you see is two lines are the Z lines. So when the Z lines approximate, so naturally what happens is the sarcomere is getting contracted, because between the two Z lines what you have is the sarcomere, and you have some thick and thin part which I will be describing to you very shortly. So that's what I told you. Thick filaments are actually called as myosin filaments because they actually comprise of the protein myosin. Has got an enzyme ATPs on it. Myosin filament have a round head on them, and the other type, the thin one what you saw, is the actin filament, which is composed of the protein actin. So this is a very famous representation you are able to see here. This is actually called as the sliding filament theory. So what happens in the sliding filament theory is the head of the myosin is going and getting contacted with the actin filaments. So during their action what happens is they form cross bridges. Now how actually this is formed is ATP gets attached to a site in the myosin filament. ATP is hydrolyzed into ADP plus B, that is adenosine diphosphate and PI. Now what happens is this ADP is released, and thereby what happens is the head of the myosin slides over or makes contact with the actin filament. So the cross bridges are formed. For this, what happens is the head of the actin also, the surface of the actin filament also should be receptive. So that means calcium and troponin should be present. So they should be receptive so that the head of the myosin comes in contact with the actin forming cross bridges. So once that ADP is utilized, then what happens? Fresh ATP comes. So thereby the link breaks. Then again that ATP forms ADP. Naturally what happens is it comes in contact with the actin. So this is the famous sliding filament theory which explains the muscle contraction, how the contraction takes place. Okay. So we have seen a little bit about the detailed structure of the myofibrils and the sliding filament theory, how the muscle contraction takes place. Now we will go to the classification of the muscle fibers mainly. So dependent or based on the type of arrangement of fibers, they can be called as, one is convergent fibers, you see the pectoralis major, all the fibers are actually converging to form a tendon. So this is actually called as convergent type of fibers. Circular type of muscle fibers you come across around your eyes, orbicularis, oculi. Then you see parallel or strap muscle fibers. This parallel or strap muscle fibers is the muscle fibers are actually parallel to the line of pull. So those type of muscle fibers where the muscle fiber, direction of muscle fiber is actually parallel to the line of pull, you come across in this type of muscle fibers, that is strap muscles. Example of strap muscle is your sartorius is a strap muscle. Infrahyoid muscles are also called as ribbon muscles or strap muscles, sternothyroid, sternohyoid and so on. So not only the strap muscles, even the fusiform muscles, the direction of fibers are actually parallel to the line of pull. So fusiform in nature, example your biceps is a very good example of fusiform muscle fibers. So as I told you, the sartorius is a very good example of strap muscles. Fusiform. Then when the direction of the muscle fibers are oblique to the line of pull, then you call them as pennate muscles. When the direction of the muscle fibers are obliquely placed to the direction of pull, then you call it as oblique muscle or pinnate muscle, pennate muscle. Pennate means feather-like. So if you have observed a feather of any bird, from a crow or pigeon, a single feather you can see, it will have this type of arrangement. In the center you have this, and the muscle fibers are actually obliquely oriented. So example is unipinnate muscle, extensor digitorum longus. Bipinnate muscles, you come across many bipinnate muscles. Rectus femoris is an example of bipinnate muscle. Your dorsal interossei is an example of bipinnate muscles. In the hand you have some short muscles, they are called as the dorsal interossei muscles. You have unipinnate muscle, you have bipinnate muscle, you have multipinnate muscles. So not only two pinnate, you have seen many things. A very good example of this multipinnate muscle is the deltoid muscle, which you see here. So what is the main idea of this multipinnate muscle? Is large number of muscle fibers are packed in a very small area. So that means it increases the force of contraction. So multipinnate. We also have one more type which is actually called as the circumpinnate muscle, which is not shown here. So the muscle fibers are arranged circularly, that is called as circumpinnate muscle. An example of circumpinnate muscle is the tibialis and kiri muscle. Okay. So strap muscles are fusiform muscles. The direction of muscle fibers are actually parallel to the line of pull. When they are actually placed obliquely to the line of pull, they are actually called as oblique or pennate muscles. You have unipinnate, bipinnate, multipinnate muscles. So here also you are able to see many muscles like that. These are all parallel to the direction of line of pull. Strap muscles. Strap muscles with tendinous intersection is the rectus abdominis muscle. So you all know that six-pack muscle, which you actually see in the abdomen. This is because if the rectus abdominis muscle is very much developed, see that. Quadrilateral muscle, you are able to see this. One example is sternothyroid muscle is an example of quadrilateral muscle. Fusiform is biceps. In fusiform, if you have two bellies, it is actually called as digastric muscle. It is actually called as digastric muscle. Gaster means belly or stomach. So it appears as if it has got two bellies or stomach. That is what is called as the digaster. Then pennate muscles, you are able to see here. This is actually triangular muscles. You are able to see this is triangular. Temporalis is actually a very good example of this triangular type of muscles. When the muscle fibers are crossing each other like that, they are actually called as the cruciate muscle. So the cruciate muscles. Then pinnate, we have already described unipinnate, bipinnate, circumpinnate or radial, which I have told you, tibialis anterior. Multipinnate is the deltoid muscle. Then spiral, when the muscle fibers make a twist before getting inserted. This type is actually seen in the pectoralis major. Pectoralis major, you see a twisting of the muscle fibers before they get inserted. An example of cruciate is your sternocleidomastoid muscle, where the crossing of muscle fibers takes place. So next, how actually the muscles are classified depending on their size. For example, if a muscle is very large, you call this muscle maximus, the largest muscle in our body. Longest muscle I told you is the sartorius. The largest muscle is the gluteus maximus muscle. When a muscle is very small, you call it as minimus. Smaller compared to that muscle in that region. For example, gluteus minimus. When the muscle is very long, we call it as longest because it is the longest muscle in that region. Adductor longus is one good example. When it is short, the muscle is named as the brevis, adductor brevis. Flexor pollicis brevis, like that. Then depending on the number of origins, whether it is originating from one or two. So biceps has two places of origin through a long head and a short head, we call it as a biceps muscle. And naturally triceps, three origins because it has got three heads. It originates from three heads, long head, lateral head and medial head. So the back of the arm what you see is the triceps, the front of the arm what you see is the biceps. So depending on size you can call it as maximus, minimus, longus, brevis. When it has four origin, it is actually called as quadriceps. So the muscle in front of the thigh is actually called as quadriceps. But quadriceps is not a single muscle. Then why it is grouped under single muscle is because all these four unite to form a single tendon of quadriceps. Quadriceps here, Quadriceps femoris, Rectus femoris with the vastus medialis, lateralis and intermedius, all four put together. But all these form a single tendon which is getting inserted into your knee. And based on the shape also, certain muscles are named, nomenclature of the muscles. Deltoid means it is actually triangular, so that is why it is actually given the name deltoid. When it is trapezium shape, it is called as trapezoid. When it is diamond shape, or this one, it is actually called as trapezoid. When it has tooth-like serrated margins, irregular tooth-like margins, you call it as serrated or sawtooth, serratus anterior. When it is diamond shape, you call it as rhomboid, rhomboidus major, rhomboidus minor. Then broadly, you can classify the muscles into axial muscles and appendicular muscles. So axial muscles which are present on the trunk of your body. Appendicular muscles mainly which is present in your limbs, that is appendicular muscles. Branchial muscles are branchiometric muscles. These muscles which develop from the branchial apparatus. That is in the neck region. One branchial apparatus will develop, will give rise to some muscles, bones, cartilages, some organs, your tongue, your thyroid gland, thymus, tonsils are all derived from this branchial apparatus. So it is not under the purview of this class to discuss those things. Okay. Now the muscle fibers, depending on their speed of contraction, that is the rate of contraction, can be classified into type 1 fibers. So type 1 fibers are actually slow fibers Here you are able to see the type 1 fibers. They are very slow fibers, and you see a lot of red color things which you are seeing. That is due to the large amounts of myoglobin which is present here. So it has got very good amount of myoglobin and slow tonic contraction. That is main thing. So one good example is the Gluteus Maximus muscle, which consists of type 1 fibers or red muscle fibers. They can be called slow tonic contraction, means sustained contraction and prolonged contraction. They don't get fatigued easily. They are rich in mitochondria and oxidative enzymes, but they are poor in phosphorylases. A very good example, as I told you, is the Gluteus Maximus muscle. Mainly your postural muscles, which is responsible for maintaining the posture. These type of slow muscle fibers are present. So mainly they use oxygen to generate adenosine triphosphate or ATP, which is actually the fuel for these muscles. The next type we have seen about type 2 or fast muscle fibers, which you are able to see here. Fast phasic contraction. These muscles are responsible for producing fast as well as wide movements, or when you want to move a large area, when you want to just stretch your hand and grab something, when you want to jump using your leg. So then what happens is these muscles or these type of muscle fibers, very less amount of this myoglobin is present. So that is why they are pale in nature. They are not red muscle fibers, they are actually white muscle fibers. They are rich in glycogen and phosphorylases. So actually glycogen is used here, glycogen respiration actually is taking place here, but they are poor in mitochondria and oxidative enzymes. So this is actually the fast muscle fibers or type 2 fibers. They are also called as white muscle fibers. They mainly bring about when you want to move a large area, these muscles come into action, but they get fatigued very easily. They are fast twitching muscle fibers. Now, the next type, what you see here is, in between these two, there is one intermediate type of muscle fibers. They are variant of type 2 and relatively resistant to fatigue, although less than the type 1. So, they don't become fatigued as fast as these fibers, but at the same time, they don't withstand fatigue like these red muscle fibers. Now, in humans, most of the muscle fibers are a combination of these two. We don't have purely red muscle type or purely white muscle type. Any one type might predominate, so other type of fibers are also present. So we have seen about type A muscle fibers. Type 2 muscle fibers, a variant of type 2 muscle fibers is the intermediate muscle fibers. Next, the mode of attachment of skeletal muscles. We all know that muscles gets attached to the bones by means of tendons. Okay. Now, when muscle contracts, naturally what happens is one attachment usually remains stationary while the other end moves. So usually the stationary end is actually called as the origin, and the moving end, which we call it as the insertion. Based on this, you also have two types of muscles. One is actually called as the spurt muscle and the shunt muscle. In the first type, what happens is when the muscle or the tendon is attached away from the joint and the movement takes place away from there. In the second type, when it is attached near to the joint and the contraction takes place near to the place of attachment. There are two types. One is called as the shunt, another one is the spurt muscle. each muscle basically has two sites of attachments. As I told you, origin, which is fixed or least moved, and the moving end is actually called as the insertion. The term origin and insertion in recent days has been replaced by the proximal attachment and distal attachment, especially in the limbs. Now, muscles may get attached, as I told you. Most of the muscles have a tendon through which it is getting attached. It is cord-like. It is inelastic. The tendon is mostly 90% is actually inelastic fibrous tissue. So here you are able to see this is actually called as the tendocalcaneus. The next type is, if the tendon is not cord-like but it is flattened. If the tendon is flattened, then you call it as aponeurosis. An example is muscle of the body wall in the abdomen. You see here, external oblique aponeurosis has a large flat tendon through which it is gaining attachment to the costal margins and also to the hip bone. Then sometimes muscle attaches by the interdigitation of these muscle fibers, and that is actually called as a raphe. An example is the mylohyoid muscle, which actually forms the floor of your mouth. And last type, what happens is the muscles need not form a tendon itself. The fibers fleshy throughout the length of the muscle. You can see, example is orbicularis. There is no tendon anywhere. Concentric fibers which is attached to the bone. So now we have seen about the different types of naming of muscles. Then we have seen a type of muscle fibers, type 1 fibers, type 2 fibers. Then we have seen how the muscle gets attached to tendon and modification of these tendons. It might form an aponeurosis, or it might form a raphe, or it might be completely fleshy without a tendon component. Now, the movements is actually a combination or a coordinated action of many muscles. It is not a single muscle which brings about a desired movement, whether it is, you see, a flexion or extension or adduction or abduction. What happens is, it is not only a single muscle. A single muscle, it might be, that might be a prime muscle, but definitely it has to be assisted by the other muscles, and there should be a muscle which checks the action of this muscle, which is going to perform the opposite action. So all those things we are going to see in the forthcoming slides. So as I told you, prime mover is which brings about the desired action. That will be the main muscle, but will not be the only muscle. When the action of the prime mover is opposed by the opposite group of muscles, it is actually called as antagonistic muscle. Then one which helps or assists this prime movers is actually called as synergists, and you also have something called as fixators. So this also improves the performance of the prime mover. So as I told you, the prime mover, to bring about the desired action, definitely it needs the help of the synergists and fixators. So a prime mover, when the chief muscle, single or group of muscles responsible for a particular movement. Now, for example, for the extension of the knee, you require the quadriceps femoris. As I mentioned earlier, quadriceps femoris itself is a group of muscles. It is a prime mover and extension of a knee joint. And we are able to see this for the extension of the knee to occur, the contraction of the quadriceps muscle should take place. So this is the main muscle which is going to bring about the desired movement. So in this case, for example, we are discussing about the extension of the knee joint, and the prime mover for the extension of the knee joint is the Quadriceps Femoris. An antagonistic muscle means antagonist, antonyms you would have heard, which is actually called as opposites, synonyms and antonyms, opposes the action of prime mover. For example, biceps opposes the action of the triceps. Okay. So when the elbow is extended, biceps opposes the action is an example of the antagonist. The antagonistic muscle should be relaxed before a prime mover can contract, which means if you want to biceps to act, the triceps should be in relaxed position. Or if you want the triceps to act, the biceps should be in the relaxed position. When the antagonistic is in a contracted position, then naturally what happens is the biceps cannot. So antagonistic is fundamentally not which opposes but which actually checks the action of this muscle, which does not go too much beyond its range. The next type what we see here is the synergist type of muscles. So these are other muscles that work together with the prime mover to produce a common action. For example, if the biceps is a prime mover, definitely it should be assisted with the brachialis and brachioradialis. So these two actually what happens is assists the biceps brachii, which is a prime mover. So synergist what happens assists the prime mover in actually bringing the desired movement. Especially what happens is when the prime mover crosses two or more joints. So here you can see the biceps actually crossing the shoulder joint, and then it crosses the elbow joint to get itself inserted into the radius. So the action is not only to assist this but also to prevent any undesired movement at these intermediate joints when it is crossing. So we have seen about prime movers, we have seen about antagonists, we have seen about synergists, and what are fixators. So isometric contraction of these group of muscles. So here we will take deltoid as the example. For the deltoid to contract efficiently, which is going to bring about mainly the abduction of your shoulder, these scapular muscles which are surrounding the scapula act as fixators. So it stabilizes the origin of the prime mover so it can act efficiently. So that's what's given here, muscles of the shoulder girdle which fix the arm to the trunk, which is actually called as the girdle, pectoral girdle here. These muscles, what happens is they contract isometrically. So an isometric contraction is what happens is there is no change in the length of the muscle fiber. So when these fixators, what happens, they fix especially the proximal part, the proximal joint, so that the muscles along the distal part can act very efficiently. Nerve supply, we are coming to the very important part, because whether it's a contraction of a muscle, decide movement, everything, for that what happens, the nerve supply is very inevitable for the muscle to contract. The skeletal muscle is mainly supplied by the motor nerves, which is 60%, and 40% is actually sensory nerves. So sensory means it is not the sensations, general sensations which we come across in the skin. We have called as muscle sensation, proprioceptive sensations we call it as, and of course pain sensations. Then sympathetic autonomic fibers, they will be to the blood vessels. The place where the nerve enters the muscle is actually called as the motor point, and it immediately divides, and that is actually called as the motor end plate, and the point and the place where is forming this is actually called as the neuromuscular junction. So neuromuscular junction is the place where the nerve comes in contact with the muscles. So mainly the muscle fibers, these are actually called the extrafusal muscle fibers, which is mainly supplied by the alpha motor neurons, that is the motor fibers, which constitute the 60%. So alpha motor neurons or alpha efferents, which supply all these muscle fibers. They are actually called as extrafusal muscle fibers. So they are efferent fibers, which brings about the contraction of the muscle fiber. Then something called as gamma efferents are there, which supply the intrafusal muscle fibers, that is the neuromuscular spindle. It is going to supply the muscle spindle. The muscle spindle is mainly responsible for these proprioceptive sensations, which refine and control the muscle contraction. Then you also have autonomic efferents, which supply the smooth muscle of the blood vessels. So here I am again reiterating, it is actually the smooth muscle fibers of blood vessels. Don't get confused whether any smooth muscle fibers are there in the skeletal muscle. Skeletal muscle is all striated muscles. So alpha efferents, which supplies the extrafusal muscle fibers. Gamma efferents, which supply the intrafusal muscle fibers, that is the muscle spindle. So this is actually a structure of muscle spindle, which you are able to see here. They are actually supplied by gamma efferents. They act as stretch receptors. So they actually record the rate and degree of contraction of the extrafusal muscle fibers. So they influence the alpha motor neurons. That is the function of this gamma efferents. Okay, act as stretch receptors. So mainly, if you look at the muscle spindle, the structure of the muscle spindle, it mainly consists of two types of fibers, and they are covered by a fibrous sheath. These intrafusal fibers mainly are of two types: nuclear bag fibers and nuclear chain fibers. The bag fibers are actually large fibers with a bunch of nucleus in the central region. The next type of fibers is actually the nuclear chain fibers or small nuclear chains fibers. They are mainly for static responders, that is, and the other one is actually the dynamic responders. So nuclear bag fibers is for dynamic response. Chain fibers is for static response. So that is a very diagrammatic representation of the nuclear bag fiber and the nuclear chain fibers. So this muscle spindle, we have already told you, it consists of intrafusal muscle fibers with nuclear bag fibers and nuclear chain fibers. It is innervated by sensory nerves and motor nerves. And motor nerves, I already told you, it is mainly through the gamma efferents. Sensory nerve endings, two types you see. One is actually called as the annulospiral endings. They are mainly to the central region of the nuclear bag and near to the nucleus. So that is why they are actually annulospiral endings. The other type is flower spray endings, second type of sensory endings. They are not in the center near the nuclear part of the bag or chain fibers, but they are somewhere away. That's why they innervate the distal end of the nuclear chain fibers. They are actually called as flower spray endings. You have annulospiral endings and then you have the flower spray endings. Okay. So with this, we have seen about in detail about the skeletal muscle, structure of myofibrils, naming of muscles, arrangement of muscle fibers. We have seen about the innervation of the muscle. What is neuromuscular spindle? Now we will come to the next type, smooth muscle. Involuntary muscle or non-striated. In the beginning of this session itself, We have told it is called a smooth because absence of striations. So in all organ systems you see this, and most of the systems, as I told you, in your viscera, abdominal viscera you come across thoracic viscera, except the heart. The lungs you come across smooth muscle trachea. Genitourinary system you come across. So varies from 15 micrometers to 500 micrometers. They are innervated by the autonomic nerves, so they are not under our control. So arrangement of fibers are different. They don't follow any specific pattern. They might be circularly arranged or they might be arranged longitudinally oriented. They also have myofibrils, which are made up of actin and myosin proteins, but they don't follow an order like alternate dark and light bands where you see it is not in that pattern. So the smooth muscle fibers, as I told you, in the intestine you are able to see they might be circularly oriented or longitudinally oriented. Longitudinally oriented, when you take a transverse section, it appears like discrete bundles throughout. So both are actually circular muscle. They are called inner circular and outer longitudinal smooth muscle fibers. So it is fusiform or spindle shaped. It is tapered at both the ends and wide in the middle with a single nucleus in the center, uninucleated, centrally placed nucleus. So if you look, that is the section with the nucleus, mitochondria and all those things. You also have pinocytic vesicles and gap junctions. These are actually called as cell junctions. Different type of junctions. We come across gap junctions, tight junctions, zona occludens, zona adherens, desmosomes. So all that we will speak in another session in the histology. So this is how the smooth muscle fibers are actually arranged. So there are two types. In single unit type, what happens is you are able to see the nerve supply is somewhat sparse, and when it reaches the one muscle, it is transmitted to other cells by the mechanical pull through the fused cell membranes. So that is, the impulse actually travels. Mainly it is a single unit type you see in the intestines. Multi-unit type is where the innervation is more, large number of nerve fibers are supplied, and naturally you are able to see that numerous neurons are actually supplying in the multi-unit type. Separate nerve is being received by the muscle cells and contraction is simultaneous, so the whole structure contracts. And very good example of this is vas deferens. In the males you have the vas deferens, which actually stores the sperms. So you have single unit type and multi-unit type in case of the innervation of the smooth muscle. So I have seen about these features of the smooth muscle: single nucleated, involuntary, mainly present in the all the visceras except the heart. Now we are coming to the cardiac muscle, very unique, special type of muscle which is seen only in the heart. Involuntary in nature. Cells are elongated with central nucleus, single nucleus in the center. You also see some amount of mild striations, not as good as the skeletal muscle. Then we have something called as intercalated disc. Here again, specialized cell junctions through which the muscle cells are attached to each other. Branching of muscle fibers and they are united by intercalated disc is a very classical example which is seen only in the cardiac muscle. This is because of the muscular mesenchytium. So the impulse, when it is transmitted, it has to pass through the whole cardiac muscle, the whole muscular organ, and for this type of intercalated discs are very much necessary. So bundles of muscle fibers, how they are arranged in the heart. the whole muscle completely contracts as one unit. Of course, the atria and then the ventricles, but then the whole ventricles has to contract. When the impulse is transmitted, it is to be spread to this whole part of the cardiac muscle. So, innervation of the cardiac muscle is mainly by sympathetic and parasympathetic. Sympathetic increases the heart rate, increases the blood pressure, and it dilates the arteries of the heart, that is the coronary arteries. Sensory fibers carry pain sensations, and parasympathetic decreases the heart rate. So, the autorhythmic cell which delivers the action potential, here you are able to see the autorhythmic cell which delivers the potential to the gap junctions. We have seen that intercalated disc gap junctions, and carries the excitation throughout the cardiac muscle. And you know this is mainly by, you know that the pacemaker of the heart is the SA node. From there it goes to the AV node, and from there you know it goes via this right and left bundle of his PrePG fibers. So thereby an initiated impulse is spread across the whole muscle and is actually taken care of by the autorhythmic cells. Innervation by sympathetic ganglia, are able to see, which gives sympathetic fibers. They form two types of plexus, superficial plexus and deep plexus. Mainly consist of sympathetic component, sensory fibers, and vagus contributing for the parasympathetic component. So finally, coming to the applied aspects, what is paralysis of the muscle? So you won't be able to contract the muscle. The muscle is inactive mainly due to the motor neurons which is actually supplying this muscle. It is actually called as paralysis of the muscle. It may be two types, upper motor neuron paralysis and lower motor neuron paralysis. So upper motor neuron paralysis is, for that you should know what is first order neurons and second order neurons. But to understand whether a muscle has undergone paralysis by to the denervation of the upper motor neuron or lower motor neurons. In upper motor neurons, we have spastic paralysis, spasm takes place. So the muscle will be very stiff with exaggerated tendon jerks. In lower motor neuron paralysis, what happens? The muscle is very loose, it becomes flaccid and there is no tendon jerks. So that is the main difference between the upper motor and lower motor neuron paralysis. Then of course, paralysis of one half of the body is actually called as hemiplegia. Only one limb is monoplegia. Then paralysis of either both the upper limbs or lower limb is actually called as paraplegia. And if all the four limbs are paralyzed, then it is actually called as quadriplegia. So this is all concerned with the motor nerve supply being disrupted. So what is a muscle spasm? It is an involuntary contraction of a single muscle or a group of muscles. So generalized spasm occurs mainly in tetanus and also in epileptic patients. So there might be two phases in this. One is actually toning phase and then you go for clonus. So cloning phase and toning phase. So muscle spasm mainly is an involuntary contraction. The muscle gets stiff and contracted. A single muscle might go contraction or a group of muscles. When this is generalizedly present throughout all the muscles, mainly seen in tetanus and in epilepsy. And what is atrophy and hypertrophy? We usually call it as disuse atrophy and overuse hypertrophy in prolonged bedridden patients. If you don't use the muscle, if you are sedentary and immobile for very long periods of time, then what happens is the muscle gets atrophy, the muscle mass decreases and it becomes weak. This is called as atrophy of the muscle. When you use a muscle too much of exercising the muscle, naturally what happens is the muscle bulges out and that is actually called as hypertrophy of the muscle. Then this is actually autoimmune disease, which is actually called as Myosthenia Gravis. What happens in the Myosthenia Gravis is certain antibodies are actually produced inside the body that bind to the acetylcholine receptors. Usually the receptors are present here in the neuromuscular junction. So once these antibodies goes and bind to these receptors, then naturally no transmission of nerve impulses. It is blocked and eventually extensive and progressive muscle weakness takes place. This is actually called as Myosthenia Gravis. So muscle is getting dead, so that is actually called as Myosthenia Gravis. Duchenne muscular dystrophy is again a genetic disorder characterized by progressive muscle degeneration due to a lack of protein, which is actually called as dystrophin, which is very much necessary to maintain the sarcolemma, so the plasma membrane of the muscle. So when it is disrupted, then naturally what happens is progressive muscle degeneration takes place, which is called as Duchenne muscular dystrophy. So progressive muscle dystrophy takes place. Enthesophagy might be acquired because usually caused by repeated overstraining in laborers or in household workers. Most common example is tennis elbow, golfer's elbow. Tennis elbow is lateral epicondylitis and golfer's elbow occurs in the medial epicondylitis of the elbow. So you know the famous cricketer was suffering from tennis elbow. So an abnormal contractions can be classified into a spasm. It's an involuntary contraction, mainly muscle cramps. We all would have experienced muscle cramps at least once in our lifetime. Suddenly muscle becoming spasm, a very painful spasm that too. Tetanus, multiple spasms. Tics is involuntary twitching of the muscle, usually in the voluntary muscles. Tremors is a rhythmic involuntary contraction. So you can see fingers are all shaking in some of the patients. Mostly you can see tremors in people suffering from Parkinsonism. Fasciculations, short twitches on the motor unit which is visible under the skin. And spontaneous contractions is actually called as fibrillis, but this is not visible. So spasm, tic, tremor, fasciculation and fibrillis are all some or the other type of abnormal contraction of the muscle fibers. So finally, thank you for listening to this session.